Ready? All right, thank you. Thanks everybody for being here. We appreciate you being here on this committee work day. Let's bring the Senate Health and Human Services Committee to order. And let's start us out in prayer. If Senator Dolezal would do that, you're on microphone number 4.
Mr. Chairman, please bow your heads with me. Lord, we thank you for today. And we just want to take a second to give thanks for the opportunity to serve your people. Thank you for the people that have given of their time to come here and advocate for what they believe. Pray for wisdom, guidance, and strength. And thank you for each of my colleagues that has taken on the calling to serve this great state. It's in your name we pray. Amen.
Thank you very much, Senator Dolezal. We're here today to hear and vote on Senate Bill 456 by Chairman Thompson, the 14th. And we'll do a little ground rules. Obviously, Senator Thompson will be presenting the bill, and then we have about over 4 pages of signups, and this room is reserved for 1 hour. So if you do the math, everybody's not going to be able to speak for long, but we do want to hear from people. We want to hear what you have to say. Let me just say that we're going to go with great decorum and respect, and that's the way we're going to handle it. I know this is a little bit of a controversial subject, but we can disagree without being disagreeable. That's the way this committee is going to be run. And I do not want to have to remove the whole audience, but listen, if we have to, we will. I hope that you will respect that. And I do not want to do that. And I hope you don't want to either. So having said that, we're going to start with Chairman Thompson to present the bill, and then we're going to have testimony and hearing, and then we're going to vote it. And if you will keep, again, we had this room till 11 o'clock. I've devoted this whole meeting to this bill alone. Again, we are having another meeting today for Health and Human Services at, does all the committee know what time we're here this afternoon? It is 1 o'clock. Good. So it is 1 o'clock for another bill. I would welcome you back at that time too. We'll be discussing the co-responder bill at that time. And I think that's an important bill, because not just because I'm carrying it, but because I think it's an important bill. Thanks everybody for their cooperation. And what we're going to do is Chairman Thompson is going to be here, and then we're going to have people come to the podium, and I'd ask you to be, in line, ready to go. And if you, obviously the first few can, voice, their opinion, who signed up first, and we're going to hear from special people, I'm sure, on both sides of this issue. And we certainly want to be respectful again. If you don't have anything to offer, we can just, you can stand up, say your name, what you represent, and so forth. Anything new, we'd be happy to hear. Thank you very much.
Good morning, Mr. Chairman and ladies and gentlemen on the committee. May I begin by extending my appreciation to GLA for their lead on this initiative, as well as many of the other organizations that continue to work towards the safety and well-being of all lives in our society. Organizations such as Frontline, led by Cole Muzio, Faith and Freedom Coalition, led by Ralph Reed, Tim Head, and Mac Parnell, Citizen Impact, headed by Paul Smith and Mike Griffin with the Georgia Baptist Mission Board. I realize I may be unintentional, missing others, but thank you to everyone that's involved in protecting these women during one of the most vulnerable times in their lives. This morning, we bring before you Senate Bill 456, also known as the Woman's Health and Safety Act. It's in response to the mail order of abortion-inducing drugs, commonly referred to as RU 486. Chemical abortion, or more commonly referred to as medical abortion, utilizes drugs such as mifeprex or mifeprestone to terminate a pregnancy. As outlined by the American Board of Obstetrics and Gynecology, under the section eligibility and contraindictions, medication abortion is not recommended for patients with any of the following: intrauterine device, current long-term systemic corticosteroid therapy, chronic adrenal failure, inherited porphyria, or intolerance or allergy to the drugs. It goes on to say that the patients may not be good candidates for medical abortion if they're unable or unwilling to adhere to the care instructions, desire quick completion of the abortion process, are not available for follow-up contact or evaluation, or cannot understand the instructions because of comprehensive barriers. As you can see, these conditions cannot be met by simply mail ordering the pills and were never intended to circumvent the supervision and involvement of a physician or healthcare provider as outlined in the prescriber agreement form issued by Danko Laboratories. The drugs were never intended to be provided without the direct involvement and continued supervision of a healthcare worker. The agreement outlines that the drugs are designed to medically terminate an intrauterine pregnancy through 70 days or 10 weeks. The agreement requests an account to be established to receive mifeprex, and the drug must be provided by or under the supervision of a healthcare provider who prescribes and meets the following qualifications. First, ability to assess the duration of the pregnancy accurately. Second, ability to diagnose ectopic pregnancies. Third, ability to provide surgical intervention in cases of incomplete abortion or severe bleeding, or to have made plans to provide such care through others, and the ability to assure patient access to medical facilities equipped to provide blood transfusions and resuscitation if necessary. Again, you can see these drugs were never intended to be delivered through the mail. Mail order drug delivery does not provide the necessary chain of custody for these drugs, assuring they are delivered and utilized by the intended patient. Additionally, providing these drugs through the mail without the woman being properly examined places the woman in unnecessary harm and is not consistent with the prescriber agreement we referenced above. We can all agree we value the health and safety of each person in our state, especially women that are facing the difficult decision of whether to terminate her pregnancy or not. This bill is simply intended to protect these women from the reckless actions of those mailing these drugs to women without ensuring she receives the proper and necessary care to ensure her health and safety, and that it's not compromised. This legislation, SB 456, will codify those requirements as established in the provider agreement that has over 20 years of FDA protocol. Mr. Chairman, I have Liz Reed next to me that will take us through the bill, if that's okay.
Identify yourself, who you're with. And floor is yours.
I'm Elizabeth Reed. I'm with Georgia Life Alliance. And sorry, I'm Elizabeth Reed. I'm with Georgia Life Alliance. Sorry. Just
Go for it. Yep, let's walk through it.
Okay. This bill will start, I guess, with line 1 to amend Title 31 of the Official Code of Georgia annotated relating to health so as to provide requirements relating to the use of abortion-inducing drugs, to provide for definitions, to prohibit abortion-inducing drugs in school facilities or on state property, to provide for related matters, to repeal conflicting laws, and for other purposes. Be it enacted by the General Assembly of Georgia, Section 1, Title 31 of the Official Code of Georgia annotated relating health is amended by adding a new chapter to read as follows. In Chapter 9C,
Testing. Yep.
oh, okay.
There you
Okay. So what this bill will do is it clearly defines abortion and what abortion does not include, specifically removing a dead unborn child, which is a miscarriage, that will never be included in the abortion definition, or removing an ectopic pregnancy. It further goes on to define the state of pregnancy as an intrauterine unborn child. So again, does not include ectopic pregnancies. Defines physicians as any person licensed to practice medicine in this state, including medical doctors and doctors of osteopathy. And if you go to line 59, as Senator Thompson said, this section would be codifying what is in the provider agreement that's from the manufacturer and is in your folders, I believe, and make sure that a physician who prescribes these drugs meets all of the requirements on the provider agreement, identify and document a viable intrauterine pregnancy, assess the gestational age, diagnose ectopic pregnancy, determine their blood type, and treat RH negativity status. In line 75, it adds 31-9C-2, saying that abortion-inducing drugs shall only be provided or prescribed by a qualified physician following the procedures contained in this chapter. It also goes on to say that the physician providing or prescribing the abortion-inducing drug has to be the physician who sees the patient in person and performs an ultrasound, determines the gestational age and RH negativity status. And in line 104, it provides for proper follow-up. It's very important for women taking the abortion pill regimen to have a follow-up appointment to determine if the pregnancy has been completely expelled, and if not, if there needs to be surgical intervention or what procedure needs to follow that. That section provides for that. And then 31-9C-4 states that abortion-inducing drugs shall not be provided in any school facility or on state grounds.
Thank you. What I'd like to do is we'll proceed with, if y'all would stay there, we're going to proceed with testimony here. We have, over 20 people that have signed up. So we're going to give everybody a couple minutes, and we'll ask those. We have a page of that favor this, and we have a page opposed to it. And then we got some pages that are mixed. So that's the way we're going to do it. So first up is Elizabeth Reed. I'm sorry, apologize. First up is Katie Glenn. And then on deck is Mike Griffin. Just everybody, just identify yourself, who you're with, and whether you favor or oppose the bill, and then your discussion. Ms. Glenn.
It's green. Can y'all hear me okay? Okay, there we go. My name is Katie Glenn. I represent Americans United for Life, and I'm speaking in support of this bill. I will email you my full written testimony to be respectful for the time, and I would also encourage you to take a look at Dr. Donna Harrison's written testimony that's in your packet. She was unable to join us today. But I'd like to just say that SB 456 codifies medical best practices to ensure Georgians get the care they deserve. This bill ensures that women see a doctor before obtaining abortion-inducing drugs, and that he or she be qualified and competent to provide medical care associated with the abortion procedure. They must verify a pregnancy even exists and be able to diagnose contraindications to mifeprex, such as ectopic pregnancy or gestational age. They must offer to administer RhoGAM for women with an Rh negative blood type to prevent future fertility problems. They must be able to assess the woman for signs of domestic abuse, human trafficking, and other forms of reproductive control. None of this can be done virtually, but now that the FDA regulation on in-person dispensing has been rescinded, there are abortionists who are willing to mail out pills without ever seeing a patient in person or even on video. SB 456 will prevent at-home, pill-by-mail, DIY abortions that leave women to fend for themselves if medical complications arise. Georgia has a legitimate interest in preventing unscrupulous abortionists, some of whom are not even licensed in the United States, let alone in your state, from mailing abortion-inducing drugs into the state and leaving Georgia emergency room doctors to pick up the pieces. Current estimates suggest that around 27,000 American women find themselves in the emergency room suffering from chemical abortion-related complications each year, and that came from a pro-abortion doctor. It's a safe assumption that number will only increase as chemical abortion is further deregulated and allowed to take place at home without any basic safeguards. Do not let this happen in your state. Happy to take questions now or over email. Thank you.
So, thank you very much. Appreciate you going to the 2 minutes. And next up is Mike Griffin. So what I'd like to do is let's get, because there are a lot of people that signed up, so we'll get questions to you two after everybody has done that. Oh, I'm sorry. Yeah. So go ahead.
To the members of the committee, real quick, you've got a thick pack. One is the testimony because we didn't want to take time. The other is real quick, the agreement that comes from the drug manufacturer, just so I know you're searching through.
So mainly for education standpoint, this drug falls in the REMS category, which is highly regulated by the FDA. And there are other drugs in there too. I can give you examples that may be a little bit more common that we all know about, or at least physicians on the group will. Some of the methadone-like drugs, which you have to be approved for to use this drug, clonazepine, which is a mental health drug. Everybody knows in the room Accutane, how that's regulated and how, well, not everybody, but if you have teenagers, you may know about that. Let's see, some of the Prolia for those who may have dialysis or chronic anemias. These are highly regulated drugs. Methadone or Suboxone, I should say, is also in that. So anyway, that's what this drug falls in that classification. And your 2 minute starts. Mike Griffin, you ready?
All right. Thank you, Mr. Chairman. Appreciate that. My name is Mike Griffin. I'm the Public Affairs Representative of the Georgia Baptist Mission Board. And Georgia Baptists represent approximately 1.3 million Georgians and up to 3,600 churches. We're the largest denomination in our state. And we fully support Senator Bruce Thompson in this legislation, which would reinstate the Obama-Trump era restrictions of delivering abortion, the abortion pill via telemedicine or direct mail in Georgia. If we're going to be a state that values life, we have to protect women from an increasingly bold abortion industry that puts profits many times over patients. And as Georgia Baptists, we have a main mission emphasis called Missions Georgia. And one of the 5 areas that we focus on is post and prenatal care for mothers. And we're concerned about that. And so we support this legislation and we appreciate the leadership here of Senator Bruce Thompson today. Thank you.
Thank you, Mike. You're at 1 minute, so you should get a round of applause for that. Thank you. All right. So Mac Parnell is, and then after Mac is Paul Smith. Okay.
Mac Parnell with Georgia Faith and Freedom asked if I would take his place.
You're taking his place. Gotcha. Okay.
My name is Suzanne Guy. Thank you to everybody on this committee and thank you to everybody present in the room. It's a privilege to be here and I thank you that we are here to make sure that women get the best possible health care. And I'm very thankful to Senator Bruce Thompson and to Georgia Life Alliance and everybody involved in this legislation. This is so important. I am a mother, I am a teacher, I'm a counselor, and I work a lot with young women and teenagers. And this legislation truly is common sense, essential bipartisan legislation. I think we can all agree on this legislation. I think we can all agree that women's health care is a top priority here in our great state of Georgia. And we need to make sure that our young women, all women, but specifically our young women get the best possible health care. And this legislation is absolutely essential to assure that. Might I be so bold to say that telemedicine abortion is absolutely reckless and not healthcare. It is careless and it is dangerous to the very young women that I serve, counsel, teach, and spend time with. And I cannot thank you enough, Senator Bruce Thompson, and everybody involved for creating this legislation to give women the best health care, to protect women from reckless healthcare decisions. This is so important. And I really feel like, as a mother of a young woman and someone who works with young women, that we must support this legislation, please, to show Georgians that we care about women in our great state of Georgia. Thank you all, and God bless you all.
Thank you. Paul Smith. Is this Paul Smith? No. All right. Lisa Kennemore. I don't think I pronounced that correctly. And then after that, we have Kay Abibia. Maybe I apologize. I did not pronounce that, but be right.
Good morning.
Good morning.
I am Lisa Kennemore, and I am here with Georgia Life Alliance. And I just want to thank Senator Bruce Thompson for this legislation to protect young women from reckless decisions that are being made, and from also protecting them from not being able to have a face-to-face counsel with doctors or anyone that they can talk to get support for in this issue or anything that they're going through. And I just want to thank all of you for hearing, for this committee hearing today. And I hope that you will support this legislation. Thank you.
Thank you so much. And I apologize for not pronouncing your name correctly. If you would help us out with that. Next, after that, we'll have John Walraven and Missy Kotke and Ann Patterson. So if you would be on deck, please.
Good morning. My name is Kay Agbaby Yee. I'm a social worker and also the Georgia Policy and Movement Building Director for Unite for Reproductive and Gender Equity, also known as URGE. I'm here to speak out against SB 246. URGE maintains membership around the state of Georgia, with the majority of our members being college students. With COVID-19, they're busy balancing the burden of jobs, work, and school while also navigating their healthcare. Telehealth offers them flexibility while also helping to slow the stop of coronavirus because of less exposure. If Georgia URGE members were to seek abortion by pills, SB 246 would make it extremely inaccessible, forcing them to attend in-person appointments, which are deemed medically unnecessary by clinical standards. This will discourage them from accessing the healthcare that they need and will be just one of many barriers Georgians face while accessing reproductive care. As a disabled person, access to telehealth is the deciding factor for me when it comes to accessing all healthcare, including reproductive healthcare. Not only is this bill awful for disabled people, SB 246 also relies on junk science, using rhetoric that is not guided by scientific research, especially when it comes to forcing providers to have discussions with patients about so-called abortion reversal. At the bare minimum, Georgians deserve legislation that is rooted in actual research, not swayed by the political whims of legislators. To put it simply, we deserve better than SB 246. URGE Georgia urges you to vote no and to use your energy for protecting reproductive care and access across the state so that we can continue to improve quality of life for our state's most marginalized. Thank you.
And thank you. So we have next up is Walraven, Kotke, and Ann Patterson. We can do that in order. And after that will be Stacy Fox and then Coco Pappy.
Thank you, Mr. Chairman, ladies and gentlemen of the committee. Generally speaking, I'm John Walraven. I'm with the American College of Obstetrics and Gynecology. We have a couple of physicians here. One is still making her way up the hill.
But just from the outset, this bill was introduced. It was dropped in the hopper on Friday. It was first read on Monday. The hearing was supposed to be yesterday. And the OBGYNs that are part of the Georgia chapter spent really all weekend working and put together a really long document and have shared it with a few members of the committee. But, this is a really complicated bill. I've learned over this weekend, I had a crash course on how these OBs handle this, and each one of them handles it a little differently. But by and large, I think what you're going to hear today is that most of the OBs in the Georgia section want to see their doctor, want to see their patient in person in the exam room to dispense that drug if it's their choice. You can accomplish that by just taking lines 75 through 81 and codifying it. We don't need to talk about experimental hormone injections into patients in state law. We just don't need to go there. This is an experimental theory. The only random clinical trial of the abortion reversal ended when safety problems happened with the patients and they were bleeding and dropping out of the trial. So, 2 minutes is really not enough to give you a legal analysis of what this bill is. So I will, I just would ask that you guys focus on what the main thing is in this bill. And we don't need to give patients a phone number of a doctor that's never seen them and that they don't know to call in case of emergency. Y'all are codifying the standards of care that are not found in medical practice.
Thank you, Mr. Walray.
Thank
We appreciate that. And while is it Dr. Kotke and then Dr. Patterson make their way up, just FYI for the committee to understand, the only amendment that was to me well in advance of the 24 hours and was the name change of this that was left off by legislative council. No other amendments are going to be accepted today. This is the first process, first committee hearing. The Senate, at times, we have been, you may have heard, we do amendments on the floor. And certainly the House, if it gets that far, will be having committee hearings and so forth. There is no bill that is ever perfect. There is no guarantee. That is always the way it is. But we don't want to let the good get bogged down by the perfect. And I do apologize for changing the meeting, and that was beyond my control. That was, if you want to blame somebody, I always like to sort of blame somebody, especially when I get sick, it's always somebody else's fault, right? If you want to blame the state of the judiciary and the Supreme Court justice, you can lay it on them, but that was beyond my control. I apologize for him, and it was my responsibility, but we did move it, and that's partly why I moved it today, so that we would get the full hour in. Having said that, I probably went over 2 minutes. You still have 2 minutes to go.
Oh,
Thank you.
I was going to work on 3. Let's see what I can do. Hello, I'm Melissa Kotke. I'm a board certified OBGYN here in Atlanta, Georgia. I'm also the immediate past president of the Georgia OBGYN Society. I stand before you in opposition to this bill because it violates my core beliefs as a physician. As a physician, I'm committed to offering the highest standards of medical care to my patients. I'm also committed to providing the care that reflects current state of the empirical evidence. I'm proud to be in a field where our practice and our patient care continues to evolve and continues to improve. As a physician, I treasure my relationship with my patients. I prioritize their needs, their privacy, and their safety. I act as a fiduciary. I collate the best of what I know about medical practice and consider my patient's unique context so that we can partner on their decisions regarding treatment and achieving their health goals. I'm saddened and highly concerned because Senate Bill 456 undermines each of these core beliefs. Fundamentally, legislative intrusion into the patient-physician relationship is bad medicine. It's bad for physicians and it's bad for patients. The requirements in this bill are contrary to the available medical evidence. I'm really glad that the senator mentioned the long history of use of mifepristone in the US. Over 20 years of rigorous research and clinical care confirms that medical abortion is incredibly safe. Indeed, with that history of safety, it is ever more clear that the REMS requirements were unnecessary and unwarranted. Indeed, abortion in the US is safer than any other common outpatient procedure or many other common outpatient procedures like plastic surgery and dental procedures. In the name of safety, this bill sets out requirements for which there's no current medical justification. Indeed, it denies medical advancements, and ultimately, this bill will put into law substandard medical care. It will do harm. First, in-person dispensing is unnecessary. Mail order delivery does not equate to lack of supervision and lack of medical care. We know that screening for contraindications that we just heard about.
If you would just give us the rest of your notes, we certainly appreciate you coming here, but out of respect of others.
Okay,
Thank you so much.
thank you.
And then Dr. Patterson, I think, is next. And then after Dr. Patterson, we do have one person by Zoom testimony, so that's where we're going to go.
All right, sir.
Floor is yours.
Thank you. I'm Dr. Ann Patterson. I'm a maternal fetal medicine specialist here in Atlanta. I practice maternal fetal medicine by telemedicine. This is not new to me. I've done it for 12 years. At the end of 2021, my company had seen over 68,000 patients by telemedicine. When I saw that this type of medicine was going to be done by telemedicine, I said to my business partner, that's a bad idea. Somebody's going to be hurt. And I think the general consensus of the OBGYN Society promotes that the patient be seen in person and you know what the problems are. And if you're prescribing the medicine appropriately, because we have all seen pregnancies that are not in the uterus with very untoward complications. So I would recommend that you all look at the comments that our society has made and hopefully incorporate them. You're welcome.
Today, so we have one by Zoom. We're here. I think this is Kai Johnson. If you just identify yourself, make sure, and the floor is yours.
Hi, I'm Kai Johnson, If When How Reproductive Justice Legal Fellow with Women Engaged here in Atlanta. We were founded in 2014 by Malika Redmond and Margaret Carbo at the intersections of reproductive justice and civic engagement. We oppose this bill. Women Engaged conducts year-round voter engagement in Georgia to empower community members to hold elected officials accountable to the issues that matter most to them. In surveys conducted during our year-round voter engagement since 2015, over 75% of Georgian voters overwhelmingly express that Georgia needs to increase access to healthcare, including reproductive healthcare. Senate Bill 456 would not do this. It would do the opposite and further restrict access to comprehensive healthcare services. When birthing people cannot have reproductive autonomy, their quality of life is forever restricted. State laws that restrict access to the very safe procedure of medication abortion limit patient access, simply. These limits disproportionately affect Black and Indigenous birthing people in Georgia. This bill limits access by unduly burdening patients and also by restricting healthcare professionals who are qualified to provide safe and appropriate reproductive healthcare. In the midst of this ongoing pandemic, the ability to receive the necessary medication for people to care for themselves via mail is critical. Just as Georgians are equipped to make decisions at the ballot box, they are capable of making decisions about their bodies without the need of legislative intervention. If Black women are not afforded the right to choose and have control over their family planning, everything from their education, health, and economic stability pays a price. Access to abortion care and comprehensive reproductive health care can and has saved lives and reduced the number of maternal-related deaths, especially in Black women still threatened by higher rates of maternal mortality within our healthcare systems in Georgia and across the country.
Thank you. We really appreciate that, Ms. Fox. Thank you for appearing for Zoom, and any further testimony you can certainly get to us by email. Thank you.
Thank you.
I'm sorry, I said Ms. Fox. That's next. It's Ms. Johnson. I apologize about that. Trying to keep it straight here. So Ms. Fox, and then Coco Pappy, and then Ms. Ulonia. Okay. All right.
Mr. Chairman, committee members, thank you so much. My name is Stacy Fox. I'm the president and CEO at Planned Parenthood Southeast. I just want to take my time to just highlight one thing about this bill. In case you don't remember, I'd like to take you back to 2019 when the legislature and the governor passed HB 481 and signed a 6-week abortion ban into law in the state of Georgia. We are also imminently waiting on a decision from the Supreme Court related to the Jackson Women's v. Dobbs case. This bill is nothing but a performative bill in the middle of an election year. Abortion has already been decided by this state, so there is no reason for y'all to be wasting tax dollars and tax dollars time on debating a bill like this. Thank you very much.
Thank you, Ms. Fox. Ms. Pappy? You have a substitute here? Okay.
Yes, she's allowed me to take her time. Thank you
Okay.
very much. I am Dr. Carrie Swiak. I'm a board certified practicing obstetrician and gynecologist here in Atlanta and represent the Feminist Women's Health Center. A substantial body of evidence shows that medication abortion can be provided without in-person visits, with high rates of successful, safe outcomes similar to those reported for in-person care. This is why national organizations, including the American College of Obstetricians and Gynecologists, support this practice, by which ultrasound, physical exam, blood tests, or follow-up tests are not required, allowing treatment to be safely provided without in-person visits. There are no tests that are routinely necessary. In patients without risk factors or symptoms of anemia, collected blood count does not increase safety. And in early pregnancy, RH sensitization is now known to be non-existent, and so blood typing or anti-D immunoglobulin is not required. Routine ultrasound is not even necessary. Only 1% of patients who were certain of their last menstrual period were found to be further in their pregnancy by ultrasound. And the risk of ectopic pregnancy among patients seeking medication abortion is less than 1%, much less than the baseline population. Thus, mandated ultrasound does not increase safety. To provide these visits, I use a secure internet-based platform to video conference with the patient. I assure her that her visit is confidential. I collect her medical history, including last menstrual period, estimated gestational age, and lack of contraindications or symptoms. I review the informed consent, review the instructions for taking the medication and what to expect. I give her my emergency number and what to call, when to call, how to call for emergencies. And I allow her to ask questions and voice her understanding. I provide her electronic copies of all consents and instructions. I send her prescriptions electronically so she can obtain them at her pharmacy. I do all of this safely without an in-person visit. Requiring her to see me in person does not increase her safety.
Thank you. Thank you so much. We appreciate you being here. Next up, I did the, somebody help me out with your name. Yes, thank you so much. I apologize. And on deck is, I'm gonna figure that out while you talk. Okay.
Good morning, Chairman Watson and members of the committee. My name is Neka Eulanu. My pronouns are they, them, and I am a staff attorney with the ACLU of Georgia. The ACLU of Georgia opposes SB 456. Medication abortion is safe and effective. These medications are so safe that the FDA recently eliminated a requirement that the medications be dispensed in person, removing a major obstacle to patient access. A 2018 report from the National Academies of Science, Engineering, and Medicine found the risk of adverse outcomes for medication abortions were both low and similar in magnitude to the risks of using commonly used prescription and over-the-counter medications. Medications used for abortions are safer than common pain medicines like Tylenol. As the American College of Obstetrics and Gynecology has found, medication abortion and the use of telemedicine for abortion care is safe, effective, and facilitates access to essential healthcare. SB 456 is a baseless attempt to block access to that care by placing it in a different legal framework than almost every other medication. While SB 456 claims to promote patient health and safety, it instead singles out medication abortion for unmerited governmental regulation based on unfounded allegations. As with all abortion restrictions on medication abortion fall hardest on those who already face barriers to accessing healthcare, like low-income people, people of color, the LGBTQ community, and those in rural areas. These barriers would create an undue burden on access to abortion care in violation with current federal constitutional protections for the right to privacy. In the case Whole Woman's Health, the Supreme Court affirmed the undue burden standard requiring restrictions on abortion access to be justified by some corresponding benefit to patients. No such benefit exists here. Senate Bill 456 represents an undue burden on an individual's access to a medication abortion. These restrictions are therefore likely unconstitutional. The evidence is clear. Medication abortion is safe and effective. SB 456 is contrary to longstanding medical science and constitutional principles and should not become law.
We sure
Thank you, and I
appreciate
yield my time.
Thank you. Yeah, not any time to yield. All right, so we're at 10:46 and we have three people from Amplify. And do they, can we consolidate this? So, because we're voting here, or we're going to have some questions here in about 3 minutes. So that's what we're going to do. If we don't have anything further to offer, other than you obviously do oppose it, then we're happy to accept your testimony and
Dr.
move
Watson,
on.
I'd love to take 2 minutes if that's possible.
You got 30 seconds.
Okay, 30 seconds. So my name is Dr. Elizabeth Mosley. I am a reproductive health researcher and doula here in Atlanta. Grew up in Savannah, Georgia and in Vidalia, and I was born at the Medical College of Georgia. I know Georgia, and I'm here for Georgia families, for Georgia women and safety. Based on my professional experience of 13 years, I'm asking you to vote no on SB 456. I have here a special issue of the Contraception Journal that includes 23 studies showing how medicine for abortion and telemedicine is actually safe.
All right,
So the
thank you.
statement that it's covered by REMS has actually been removed, and I'm happy to give you the readings for how it is safe now
Well,
so
thank-
that you can update yourself on the scientific evidence. Thank you so
Dr.
much.
Mosley. Appreciate it. All right, listen, let me just say, listen, if you're going to click or express your opinion, that includes my committee, we have security right outside the room. And I don't want to do that. I asked earlier, let's be respectful of everybody. We can disagree, but not be disagreeable. So, all right, thank you. Thank you so much. So you just submit that. You can do it. Thank you. So I wanted to give Amplify, anybody? Amplify?
Good morning.
Good morning.
My name is Allison Kaufman. I'm the chair of the Atlanta Reproductive Justice Commission and the director of Amplify Georgia. I'm here today because the Georgia legislator continues to try to deny Georgians their fundamental right to access abortion care. This has been happening since 2005 with over 13 medically unnecessary abortion restrictions, and SB 456 is just another bill following the same pattern, has really nothing to do with health and safety and everything to do with restricting access to care. This bill in particular is based on misinformation and junk science.
So I really appreciate that. We're running. You can certainly submit that. I really appreciate that. Thank you. Or have, I apologize. Thank you. Appreciate that. So what we're doing now is we're going to back to Chairman Thompson, then we're going to have questions, and then we're going to vote.
Thank you, Mr. Chairman, members of the committee. We've had some interesting conversation around this legislation, but I think some have been confused on whether or not it was a different bill than this bill. Certainly the bill that's before you that you look at is very concise in what we've done. We are simply trying to make sure or ensure that we're protecting the women in the state of Georgia. You clearly can look at an article on your own if you research it. The CDC has put out the guidelines that our mortality for pregnant women in 2020 ranks very, very high from complications. We want to avoid continuing to provide complications, especially from a drug like this, Mr. Chairman.
Thank you. We're going to ask questions. Dr. Senator Al is on number 9.
Thank you, Dr. Watson. Thank you, Senator Thompson, for coming to present. I have a couple of questions. Some of them are fairly granular, so I appreciate you walking me through this bill. The first question is on line 25. It includes 3 medications in this list: mifepristone, misoprostol, and methotrexate. Later on in the bill, in line 85 and 86, it says that these drugs do not treat ectopic pregnancies. However, we know that methotrexate is often used to treat non-ruptured ectopic pregnancies. So that's actually incorrect.
So again, the bill's not perfect and we say we're going
Right,
to
so
accept
I just-
amendments.
when
We
we-
talked
when we
about
revise
this.
we
So
probably should
gotcha.
take
Thank
that out
you.
because that's not correct. Sorry, I have a couple more questions. Next thing, in the listing of line 76, it says the abortion-inducing drug should only be provided or prescribed by a qualified physician. This is based on, I believe you presented some 2016 REMS data. Are you aware that in 2017, the FDA gave an update for the use of mifepristone that says that APPs, that is advanced practice nurses, physician assistants, and other mid-level providers like midwives can prescribe mifepristone? So we probably need to.
So in
update that.
2019, they did an update on that also. So I got you
So
again.
that's-
Got you.
that's
Thank you.
Probably needs to be corrected. So just a couple more things that are very practice related. Next thing, line 98. Says a qualified physician providing abortion-inducing drug must be credentialed and competent to handle complication management, including emergency transfer. Does this, to your understanding of the bill, include admitting privileges? Yes. Are you aware that previous Supreme Court cases have found that requiring admitting privileges for providing abortion care is unconstitutional?
So that is not specific in that language. And so if a person has a follow-up, I mean, that's going to be a matter of interpretation. That's going to be a person with follow-up. And the follow-up or complication relating to that the person prescribing this would have someone on call, or they would be doing it themselves, or they would have a relationship with the emergency room and so forth.
Given that there's confusion, that probably bears some clearing up. One other thing, line 105, it discusses an appropriate follow-up visit. Can this follow-up visit be done via telemedicine? I think is appropriate, but not clarified.
That would be up to the discretion of the doctor. Appropriate is an intentionally vague term because it's up to the physician's discretion. If they talk to the woman and she indicates that she's had a high degree of, bleeding or other complications, then they'll ask her to come in, but that would be up to their discretion.
I appreciate you leaving that to the physician's discretion. One final question related to line 118 that restricts provision of these medications in institutions of higher education in the state. First part, does this include private universities? And second question, does this include university hospitals, such as, for example, Emory University Hospital?
It would not include a hospital. Institutions of higher education would be colleges and universities. The hospital, I believe, would be
Institutions
excluded.
of higher education. I would probably bear some clarification because that has some major implications for patient care.
All right.
Thank you.
Thank you, Dr. Al. All right, we have other questions? Senator Orrock is on mic 2.
Thank you, Mr. Chairman. It's of course very difficult to, in this limited time, to have a comprehensive discussion about this vital matter for women. Are you aware that 70 to 75% of Americans and Georgians want to leave the laws on abortion, Roe v. Wade, in place and not tamper with? Are you aware?
So let me just clarify. Listen, I respect your opinion, but this is not what we're dealing with. So way I understand, let me make it clear, is that so prior to emergency use authorization, because of COVID and people coming in to get COVID, this is basically the way it was done. It is still the emergency is what we're doing. We're still dealing with and still dealing with and still dealing with, and we may be dealing with for the rest of our lives. I don't know how long the federal government is going to continue the emergency. This puts it back to where it was before. We've done this very narrowly. We've done this to the point that we have made multiple substitutions and changes with this prior to this. And listen, again, there may be changes in the future too, but this is where we are. And if there are no more questions, okay, all right. If we have a question, and listen, let me just tell you, if we're having a question on the bill, we'll entertain that. Thank you.
The
Okay.
question is, what are the penalties for a physician violating the measures that this bill attempts to put into law?
The penalties are in that same chapter. It would be the same as the women's right to know or women's informed consent chapter, that there'd be civil penalties to the composite medical board.
Civil penalties to the composite medical board.
Civil penalties, and they would, be reported to the composite medical board. So,
All right, you want to clarify that? Yeah, it's composite board medical examiners is where this would go, right? It's not in the bill, so that's not in the bill the way I understand it. So,
it's in that code section.
any other questions? Minority leader?
Night two as well.
Are you on two? I'm sorry.
I don't have.
All right, late arriving, that's you'll learn in the future. Gotcha, go ahead.
Thank you, Mr. Chairman. Those of us that serve on this committee that are not doctors, what gives us the authority to go against what the FDA says and the doctors when they say this is a safe practice for women?
Yes, go ahead. Good question.
Yeah, great question. We deal with legislation all the time where we're trying to protect individuals. Again, if I just go right back to the manufacturers, this drug, the subscriber agreement to be able to dispense this drug is outlined. And it's outlined point by point that I just talked about. That is being circumvented. And so it was never intended by them. We all the time as legislators take up different issues that maybe we're not experts in, but push it right back to what it was intended to use.
The FDA says, and doctors,
In the
when they
emergency,
say that this
Right.
practice is safe.
in the emergency use authorization, that's correct. We're going back to what it was before. Got you. Dr. Kirkpatrick is on number 12.
Yeah. So Senator Thompson, isn't it true that in spite of the recent FDA ruling that the REMS status of these drugs is still in place? It's still considered a high-risk drug by the FDA, and it's on their website as recently as yesterday.
That's
Is that
correct.
not true?
That is correct.
You look like you have a question, Senator Walker.
Mr. Chairman, at the appropriate time, I'd like to make a motion to pass.
Whoa.
Okay, so
Do pass Senate Bill 456, LC 338983.
and we have a do pass, and I'm recognizing that. And do we have a second? Have a second from Senator Dolezal. And hold on just a minute. We have, we're going to come to discussion and an amendment here.
Yes, Mr. Chairman.
And I'm going to rely on y'all to help keep me straight with the amendments and flying around. So, all right, you're on number 11.
Yes, Mr. Chairman, number 11. I have an amendment that is actually in every committee member's packet, amendment number 331995, that simply adds on line 4, after the word matters, the following: to provide for a short title. And then it then adds on in section 1 that this act shall be cited as the Women's Health and Safety Act. They were inadvertently, these changes were inadvertently left out when they wrote the bill.
I appreciate that. And you discussed that with me ahead of time. So we have an amendment that's being offered. Do I have a second on that amendment that's offered? Yes, Senator Burke nods his head. And any further discussion on that? And so all those in, I'm sorry, Senator Dr. Al.
Isn't it true that the legislature should not be in the practice of legitimizing?
So hold on.
modifying
So
suicides?
so Dr. Al, so this is a discussion on the amendment. Okay, I got you. Okay, all right, I got you. So all those in favor of the amendment, raise your hand. Got 7. All those opposed? 7-5, it passes. All right, so we have the bill that was Senate Bill 456, LC 338983, as amended. Did I do that correctly? As amended. That is where we are right now, and we're at the portion of discussion. So that's, and my colleague from Savannah
I have a
is
substitute
here
motion.
on one.
Mr. Chairman, I have a substitute motion for Senate Bill 456 LC 3389.
So
83.
and you were probably a late arrival, and if you remember correctly, that I'm not accepting any substitutes or amendments. We've discussed this far along, within 24 hours received. If you'll check our rules, that's what they state. And so the only one I accepted that was done, and that was the name change. It was really legal counsel left out. But there's the floor, there's, if it passes, there's the House, there's HHS or whatever it is in the House and so forth. So, all right, so we're, any further discussion?
You accepted amendment from the senator from the 50th? You accepted amendment from the senator from the 50th to the bill?
I did.
And you don't want to hear my substitute motion?
Well, if you check the rules, look at the left hand of this, of your thing, and it says down there, rule number 8, at least 24 hours. And that's what I agreed to. Everybody agreed here, and that's what we're doing. Any further discussion?
It was submitted before.
No further discussion. We have a motion to do pass. All those in favor, raise your hand. So we got 1, 2, 3, 4, 5, 6. I didn't count that right, did I? Oh, 7. I'm sorry. 7. All those opposed? All those opposed? No, we're doing hand count is what we're doing. So, and we got 1, 2, 3, 4, 5, 7, 5, it passes. Gotcha. Yeah, if we're, yes, absolutely, Senator Orrick, that is, you're always doing that. I think that's these, you can certainly do that. Yeah, I think that's in our rules too. If it not, it should be. I appreciate that. Just to thank you, Senator Thompson. Excuse me. Thank you, Senator Thompson. We have a meeting this afternoon at 1 o'clock, and probably room won't be quite as crowded, but I think it's a very important bill. Meeting is adjourned.
Thank you, Mr. Chairman.